John Bell. I'm a community pharmacist by background. I also work for the Pharmaceutical Society in terms of developing consumer education, health education, and staff training, that is pharmacists and pharmacy staff training. I'm also a practitioner teacher at one of the universities in Sydney, the University of Technology Sydney, in the Graduate School of Health. So looking at primary healthcare issues really, how pharmacists would assess people who come in present with certain symptoms. Do they refer, do they treat? What treatments do they use? What counselling do they give? GRIP, the Global Respiratory Infection Partnership, is an international multidisciplinary group of health professionals, doctors, pharmacists, both in general practice and specialists, virologists, microbiologists, respiratory physicians, researchers, committed, all of us committed to researching, promoting, developing and certainly implementing the rational use of antibiotics. We know, for instance, that antibiotic use, the irrational use of antibiotics sometimes, but just generally the use of antibiotics has led to resistance, antibiotic resistance, which has become, and even faster becoming, a critical issue worldwide. Antibiotics are inappropriate for upper respiratory tractions because of the fact that 90% at least of upper respiratory tract infections will not respond to antibiotic therapy. They're viral infections, so antibiotics won't work. The other small minority of bacterial origin infections, the antibiotics are not all that great there either. There's no benefit in terms of duration or severity of symptoms. One of the issues there, however, is that it would appear, certainly from the research we've undertaken, that doctors feel under pressure, general practitioners in any event, to provide an antibiotic. They believe their patients want an antibiotic. That's not always the case. What we have found is that patients want relief from their symptoms. So the pressure that the doctors sometimes feel is misplaced pressure. Hence the need for us to get that message through to doctors that patients want relief, they don't necessarily want an antibiotic. Some do, hence the need for us to change the behaviour. Behaviour change is a mighty difficult thing to even attempt, let alone to succeed in. But we need to change the behaviour of the prescribers and the patients. The patients to less often demand or to believe they need an antibiotic, and the doctors to understand that most of their patients don't want an antibiotic. They need relief. That's where symptomatic treatment comes in really the first choice option. I think GRIP, the Global Respiratory Infection Partnership, has a really important role to play. On the one hand, to make us all, healthcare practitioners and the general public, our patients, aware of the fact that antibiotics should not be their first choice for upper respiratory tract infections, but also to develop, as we are doing, the solutions to the problem, the alternatives. If not antibiotics, what? What symptomatic treatments are available? These are those which are most effective. And of course it will depend on the particular symptoms that a patient might have. There are a number to choose from, and we can tailor-make those health solutions. We believe pharmacists are in a great position to be the bespoke healthcare advisors and recommenders of treatment. Behaviour change is an enormous challenge for us, but one of the protocols, if you like, that GRIP has come up with is the 1, 2, 3 approach. So number one, to assess the patient for the most troublesome symptoms. And this will vary from person to person, maybe from time to time in the same person, but to identify the most troublesome problems or symptoms that the patient has. Secondly, to be vigilant, look out for the red flag symptoms, the warning signs that may require referral from a pharmacist, perhaps to the general practitioner, maybe from the GP to the specialist. But look out for signs where perhaps symptomatic treatment is not most appropriate. Then thirdly, to counsel the patient, not only to give the right advice in terms of the most appropriate treatment, but to counsel that patient on how best to use the treatment, to optimise the treatment, to maximise the benefits, reduce the risk, and ensure as much as we possibly can that the treatment is tailor-made for them and they get the very best possible health outcomes that they would like and they deserve. Clearly, it's important that both doctors and pharmacists have not only the skills, and the skills in terms of maybe verbal communication, the knowledge of the products available, but also it's very helpful to have materials to provide to the patients, to add value, of course, to the recommendations, and to explain more succinctly, more clearly, in lay terms, just why we're recommending treatment of symptoms and not antibiotics. And GRIP has developed these materials. You'd be surprised if I didn't say they are great materials. They'll be available in some countries. They're already available in pharmacy and in doctor surgeries to identify the antibiotic resistance problems, but also to clearly identify what the solutions are to the treatment of upper respiratory tract infections. And importantly, if you haven't seen those materials in your pharmacy or in the doctor's surgery, they're all available online at the GRIP website, which is www.grip-initiative.org.